So, and in the process of doing that, did you suffer any setbacks? Like, did anything, take you back a notch, or any problems that came along? I mean, you don't have to get personal,
Mhm.
but did anything, kind of level you and put a stopper on your goals for a little bit?
No, I mean, to be completely honest, I feel like, once relocating to Columbus and opening my doors, everything has really just continued to increase, right? So, um, prior to COVID, I had probably had my best year, right? And even being able to go through COVID, I really feel like a lot of days I don't pat myself on the back for a lot of things, but being able to really navigate through COVID and still be here, and still, for the most part, be doing very similar volume, if not better now. I feel like is also a pretty good win, right? Because so many businesses really suffered with COVID, and so many places around here have closed, chiropractic offices too. So just being able to actually, come through that on the other side of it, and am now pretty much back to looking like perhaps my one of my better years. It's just been a steady incline, really.
Great. That's really great. Um, and so you must be very consistent in what you do right.
And again, I don't like to necessarily pat myself on the back, but I think I am, right, in the sense that my model or the way I operate has generally always been to just show up every day. In the beginning, that was to show up no matter how few or how many patients were actually on the schedule. Show up every day, give each patient 100% of myself, right? Try to help them meet whatever goal they were aiming for, all while staying true to myself, right? And I think that patients appreciate the authenticity that they get from me. I think that they know, I'm certain that they know that I try to give them all that I have and help them in any type of way, right? So I have patients, a lot of times my employees will say, well, which kind of aggravates me, but that's another question. That's another topic. They'll say, well, why did she come and see you for that? Like, shouldn't she have gone to such and such a doctor? Or she should have done that. And so my response is always, well, not really. But I think the other thing is that my patients trust me because they know that even if it's not something that I am going to attempt to take on by myself, I'm going to try to make sure that they know what the issue is and where they need to be, right? And so that alone has, I think, kind of been something that helped me because if nothing else for patients, I'm resourceful.
Yeah. I think that's what people want from anybody is honesty,
Mhm, mhm,
and
mhm.
I was actually, I just had a conversation with my son, and he was talking to me about a personal issue, and
Mhm.
oh, and I said to him, I said, well, okay, so why'd you say that? He goes, because it was honest, Dad. It was
Right.
honest. He says, I'm not a bad person. I'm a good person. I'm going to be honest.
Mhm,
I said,
mhm.
well, okay, sometimes, there's honesty, but you also want to be tactful, and
Right,
how you
right.
portray that honesty. You want
That's
to
the
be
lost
kind.
part. Yeah,
Right, right.
yeah,
Truthful, yes, but
yeah.
tactful also. So,
Right, right.
I think that patients really appreciate it when we tell them, I think it's time to consult somebody else now, or you know
Mhm,
what, I
mhm,
really want to look that up or pay attention to that
mhm.
and do a
Right,
little
right,
research on my own.
right.
They love that, and I
Mhm,
know I do. When it's somebody
mhm.
else for me. So
Right,
that's great, and
absolutely.
that authenticity builds trust, and that's all they want to be able to trust you. So
Exactly,
that's really,
exactly,
really great.
exactly.
Okay, so